Postpartum depression is a mental health spectrum that includes sadness, anxiety, and despair in the year after giving birth. A diagnosis is made when these feelings prevent the mother from being able to perform her daily tasks. On one end of the spectrum is the mild, common condition known as baby blues, and the other extreme is postpartum psychosis, where the mother is a danger to herself, the baby, or others.
The known risk factors include increased family conflict, fewer social supports, low self-esteem, a previous diagnosis or family history of depression or postpartum depression, and unwanted pregnancy. Non-psychotic postpartum depression is a notable health problem that affects women and families. It is the most common complication of childbearing. About 10 to 15% of women will experience postpartum depression after giving birth.
Many negative effects of depressed mothers on the infant's development have been noted. Research shows that children are more likely to have cognitive and emotional issues during development when their mother is depressed. Instances of negative effects on the baby and abuse increase when the mother's depression isn't treated. The depressed mother is more likely to perceive that the infant is maladjusted and is more likely to use negative communication with her baby.
A depressed mother is more likely to practice punitive parenting by being more controlling. She's also more likely to think her child is too emotional. The mother is more likely to have a flat affect or expression when interacting with her baby, and the baby's more likely to respond by being fussy or less relaxed. They have less optimal interactions than other mother-baby dyads. And the infants who had mothers with acute postpartum depression show more negative affect in interactions with other children and adults.
A recent study found that the children of mothers with lower depressive symptoms were reported to have fewer emotional difficulties than children with mothers with higher depressive symptoms. Resilience, defined in this 2015 study as a positive adaptation despite adversity, was found in about 1/3 of the infants. Kids who showed more nonverbal communication at 15 months and whose mothers were more positive about parenting were more likely to show more resilience when evaluated late in childhood. Early intervention can aid with increased resilience.
The worst risks to babies of mothers facing depression are the potential of the mother to harm her baby and maternal suicide. Maternal suicide causes 20% of all postpartum mothers' deaths. Another very damaging effect of PPD is the long-term difficulty in bonding between depressed mothers and their infants. Bonding difficulty is not only caused by depression, but depression is a major reason for it. These are all important reasons to screen for depression and take measures to prevent and treat it.
Depressed women's most common barrier to getting help is the inability to reveal their feelings. This can be reinforced by reluctance of family or even healthcare providers to recognize the mother's condition and have an appropriate response. The many myths about postpartum depression in our culture and the general ignorance of its impact can be enormous barriers to its recognition. This prevents many women from getting the help that they and their babies deserve.
When depression is recognized, early treatment is likely to reduce problems, as we mentioned previously. Early intervention can be an important factor for babies' development. Talk therapy in individual and group settings are beneficial to all women receiving treatment for PPD. Other treatments may include parenting skills classes and nutritional supplements. In more severe cases, the addition of pharmaceutical medication may be recommended.
One technique found to reduce depression in mothers is to massage their baby. A study compared depressed mothers whose babies were being released from the neonatal intensive care unit, or the NICU. They either observed their babies being massaged or were shown how to perform baby massages themselves. Both groups had reductions in levels of depression, but the massaging group showed more significant results than the observing group. Here's a video demonstrating one way that mothers can massage their babies.
Little stretchy things too, you know, like little crossing the arms and then opening them. Type things like stretching the little arms out. We did like little digestive.
My hands are cold.
Digestive ones. Like little circles, little crescent
Shapes.
Hi,
Yeah.
is that cold?
Here, let's see if you might even make some massage, baby. But yeah, and then there was I'm trying to remember there was the milking is what they called it, right? And is that what they called it in that book? Like where the arm and leg ones were there was that's what they called it, was milking, because you kind of go one way and then the other. It's for circulation or something, maybe?
Oh, when you're pulling.
So if you pull, she's like,
No monkey.
Oh,
so we would do one way, and then the other way was this way. There was Indian milking, and then something else. There was another term for it.
You know more about it than I do. I
I
have a
know.
pretty picture book, but I've never really read it.
I like when between your toes, because usually fuzzes and stuff get caught.
oh, you need a bath.
I'm so glad she's feeling better though. She was couldn't I set her down yesterday. So there's still books all over my living room. I'm just I gotta give up. Something's gotta give.
Yeah.
And then, is it cold? Is it cold? Does it feel good? Yeah, so it was she had this little one that was it follows the track of the colon. So if they're fussy, and it was I love you. So you make an I, and then you make an upside down L, and then make a U shape. I really liked that one.
Here, what if you looked this way? I'm gonna try looking this way. I like the patterns in there.
Everybody that I brought it up to didn't and I'm oh no.
Hi.
Lower rates of exclusive breastfeeding, less frequent breastfeeding, and ending breastfeeding early are associated with maternal depression. A direct cause-effect relationship has yet to be established between breastfeeding and lower depressive symptoms, but it's known that breastfeeding has many positive effects. Breastfeeding benefits babies, including more positive health outcomes and easier temperaments. The benefits for the moms include health benefits and reduction in stress and less negative mood.
Prolonged breastfeeding also has the benefit of reducing retinoids in mothers. Retinoids are vitamin compounds related to mood disorders. It is suspected to reduce depression by decreasing the retinoid volume in the woman's body. This study by Mawson showed benefits to women who breastfed for a longer period of time, as opposed to women who formula fed or stopped breastfeeding early.
Early intervention and treatment of PPD is important for the mother-infant relationship and the baby's cognitive, social, and emotional development. Postpartum depression is a very serious condition that needs more recognition, screening, and treatment. Thank you.
You're welcome, it's my prize.
Yep.
I got paid in coffee and a cup. Yep. But I could also just like wash it and put it on my step. Grab it.
I really don't care. I think I've never used it. So, or you can pass
You want to go to sleep or something?
it. Do you want a copy of the thing after I make it?
Sure.
It might be kind of boring.